patients are frequently told maybe they have, symptoms or abnormal stress tests, and the cardiologist will say, okay, I'm gonna do a coronary angiogram and you're likely to get a stent or consent you for a stent. But when they go in, they may see something that can't be stented, or it's too much disease, or maybe it's not enough disease that will qualify. So this is a situation that's too much disease.
So I'm presenting Miss Elle Etch, who is 59 years old, female. She had been diagnosed with coronary artery disease in 2020, and her condition started when she experienced severe chest pain and went to the emergency room. At that point, she had angiogram and possibility of stent placement. But she had been told that she had multiple blocked arteries.
So after they did the coronary angiogram, they saw multi-vessel disease.
Yes.
And said this is not a candidate for PCI, go see the surgeon.
Yes. And they suggest the triple bypass. So the patient decided to ask more questions, and she has a meeting with the surgeon to understand exactly what's the bypass and how it's going to be done and where it's going to be done. At that point, the surgeon revised the images again and everything, and he was uncertain where exactly everything can be done, and then he mentioned that it's inoperable.
With that heart model, I'm going to share something with your audience because I think it's important for us to understand this. So when you do a bypass, right ventricle, right atrium, left ventricle, left atrium, these little red things coming out here, the arteries on the outside. When they do a bypass, they'll come from the aorta with a vein graft to one of these surgeries. So let's say you have a narrowing right here. The rest of the vessel looks pretty clear. You have this artery and there's a narrowing right there. So right there is open. They can do the bypass from here, go past this and go here. But sometimes the narrowing is not only in one place, but it's all the way down the vessel to the tiny part. So you go here, if you try to pass this one, you got blockage all here. And this is too small. And the surgeon will call that very poor targets. If you try to tie a vein vessel into a small vein graft in a small vessel, now you can get good flow. So this is not a good vessel bypass, even though there's bad flow through here. A narrow stenosis in one place can go here. And even if it looks open here, there's still disease, but still maybe not enough. If there's a lot of disease here, you don't have anywhere to go. This is probably what they saw. And so the surgeon took a look and they asked close question, where are you going to tie in? So, well, I can probably go here, but it's not going to be the best. So after consideration, they decide, look, it's not the best, let's go medical therapy lifestyle. And we're just now seeing her and starting to work with her. But this is a situation where she did the right thing. And so she started changing her lifestyle. As you pointed out, what did she do?
She mentioned that she started lifestyle and diet modification. The first thing she did is detox, raw detox for 10 days. And she mentioned at that point, the chest pain subsided completely. And she noticed following that when she eat bad food, she experienced the chest pain.
Yes. And that's a great testimony there because she immediately got relief with an aggressive plant-based diet.
Yes.
And then when she would go back to the standard food, she would have more symptoms. What she needs is a much more prolonged, aggressive nutritional intervention. And there's some other things that we can add, external account pulsation or ECP therapy. We do phosphatidylcholine infusion. These things will open up the vessel, infrared sauna therapy, and all those things. And she mentioned her goal. She used to exercise in the past. She wants to get to back where she can do, high intensity exercise like burpees. We said if she's aggressive enough, we can get her back to exercising within, 4 to 6 weeks, and maybe high intensity exercise 8 to 12 weeks. And so here's a situation where someone has very advanced heart disease, and the so-called ideal procedures, stent, bypass surgeries are not active, but she has to get to the superior therapy, which is optimal nutrition. And that allows the body to heal itself. And so I look forward to working with her and giving you follow-up in terms of her progress. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.